Female genital mutilation, a procedure which involves partial or total removal of the external female genitalia. Nigeria, due to its large population, has one of the highest absolute number of female genital mutilation worldwide. While some regard FGM as a tribal traditional practice, others practice it for preservation of chastity and purification, protection of virginity, and even prevention of promiscuity.
Genital mutilation is defined as any operation or procedure that is done to remove in parts or in whole a woman's external genitalia. And what makes this a mutilation is the fact that there is no medical indication for the removal of these parts. So in that sense, it has been with us for a very long time. It's not, solely an African thing. It has been found to be practiced in other countries, other continents, and for different reasons. But with a better understanding of the problems that are associated with female genital mutilation, there have been calls over time and a lot of concerted action, a lot of concerted efforts to end female genital mutilation.
Speaking further, the medical practitioner explains the adverse effects this practice has on the health as well as psychology of women and girls.
Health-wise, there's so many problems that can come from it. Women, because this procedure is usually or conventionally is done in traditional settings where there is no regard for health, for safety, for protection against blood-borne disorders and all of that. Tendency is to use materials which are unhygienic and at the end of the day pose a risk. So women can get infections from the procedure. They can get conditions like tetanus, which can be is typically caused by agents that are in rusty materials. They can also get bloodborne infections like hepatitis B, hepatitis C, HIV, because of course the instruments being used are not necessarily sterile. They can lose a lot of blood and they can lose their lives in the process. And if they do survive that, as they grow older, they start to have other complications. So some complications may include very painful menstruation, because there are different types of female genital mutilation. Some of them are done in such a way, that's infibulation, it's done in such a way that only a hole, there's just a tiny hole left. And that hole is supposed to be where urine comes through, where the blood of menstruation comes through. So they can be in severe pains. This can cost them school hours, cost them productive hours of life and living. It can also cause infertility.
Amond elaborated on the need to tackle and eliminate this deeply rooted legendary practice, as it is harmful to the health of girls and women.
This aspect it requires a concerted effort. It's all hands on deck, because we as clinicians, we see the outcomes, but the practice is entrenched in communities, is entrenched in traditions, in some traditions, and it will take a concerted effort nationally, state levels and community levels to actually break this cycle and this problem called female genital mutilation. It will take, basically, we are talking about a problem that has become deeply rooted in traditions, even though they might not be clear. The explanations are very complex. There are different things, but the undertones speak to the fact that, poor education or lack of education, poverty are very big in big factors in propagating, the cycle of female genital mutilation, among other factors that may not be exactly well understood.
Female genital mutilation is recognized worldwide as a fundamental violation of human rights of girls and women. It reflects deep-rooted inequality between the sexes, and as such, many have clamored for the need to abolish this unhealthy practice. Ololade Oke, KAFTAN TV, Lagos.